Welcome to Something Positive for Positive People. I'm Courtney Brain. Something Positive for Positive People is a 501c3 nonprofit organization that essentially serves as self help and mental health resources for people navigating herpes stigma. You can visit the new website, which is up and running right now. I think it's complete. www.spfpp.org. You'll notice some changes. It doesn't look like a newspaper that a 12-year-old put together online anymore. I actually went out and got some professional help. Shout out to my friend Jenny for putting that website together. And you can support us by donating at www.spfpp.org, which is a lot easier for you to find how to do that. And you can also leave a rating, review for the podcast. Today's episode is going to focus more on healthcare. So if you're here for herpes stuff, go ahead and go to a previous episode or skip to the next episode. But this is still a very important discussion to be had because I think that it sort of explains or sets the stage for what's to come from something positive for positive people. I don't know that it's necessarily going to be the very next thing done, but so far I've done so much interviewing on the patient's perspective of what it means to receive a STI diagnosis, but there's not really anything from the healthcare providers. We hear from people who have good experiences, bad experiences, and experiences that don't necessarily stand out. But I want to give healthcare providers sort of an opportunity to speak to what their needs are, what they're seeing, and how we can be better patients as well from their perspective. And I want to take the lessons from you all and incorporate that into some form of an intervention to support healthcare providers with being better providers. So today I brought on now we become friends. We used to be work colleagues, Emily, and Emily and I met in 2018. I want to say it was toward the end of 2018, middle or end of 2018, and we started working together. If you've been listening for a while, you remember those dating positive ads. Dating positives.
Yeah.
That's how old it is.
Yeah.
But yeah, we were working together on that, and part of that was this campaign called We Need a Button, which was advocating for queer-friendly healthcare. And was it more than that? I tried to simplify it. That's how I would explain it to people.
Yeah. Hello, everybody. Yeah, We Need a Button there was two parts of it. The deep purpose of it was to bring to light the fact that queer people, basically, I would say it's very hard to meet a queer person who hasn't had a negative experience in a medical setting for whatever reason. But I would actually say probably just everyone on earth. It's sad, but we were focusing on queer people at that time. And the idea was, wouldn't it be nice if there was a way where you could find out if your provider was competent, and not just competent, but affirming when they provided their care. Hence the button of a filter on something like ZocDoc, which might kind of exist, but the problem is with the existing buttons for things like that, it's hard to know exactly how they're actually coming up with those ratings and responses. So the idea is, how can you vet a provider better? How can there be a big list where people can find these, these affirming providers? And then the other part of that, if you remember, was the pun on button with butt, and it was take a butt selfie. It was during Pride. It was show off your butt in a cheeky way, ha ha ha, to kind of make this declaration of, healthcare kind of sucks. How can it be better for us?
Yeah, and unfortunately that just kind of died, did it?
The whole thing died. We don't work there anymore. I'm not even, as I was just saying, I'm not even on speaking terms with the company who kind of put that together. So I don't think they're doing anything with that.
Yeah, you're doing something completely different now.
Yeah, I'm doing something completely different now. And honestly, that I will just say that was the best part of that experience was meeting you.
Oh, thank you.
Yeah.
You were very pleasant to work with. So Yeah, I thought that you'd be a really great person to come on and I guess just like speak to uh, that campaign the way that you just did, of course. And this to me is more like an accountability podcast for me to actually do what I say I'm going to do because one of my board members, Dr. Evelyn Molina Dacker, she just gave a donation of $50,000 to continue doing what I'm doing. And it's very difficult for me to quantify what it is that I do, but I know that she's a family care physician. She's very much an advocate for sex positivity, and she is like the alternative, the most like queer friendly healthcare provider, accepting provider that you could come across. So we had been in conversations about something like this before, which is essentially putting together opportunities for healthcare providers to take a sexual history and allow for them to receive feedback from their patients. So this would kind of require me to recruit sex educators or people, or even just give like everyday people a general training and have them get tested and share with me what their experience is and then reach out. I don't know exactly what this looks like. I've made outlines, I presented like proposals in different ways, and the more I talk about it, the more it changes and sort of refines itself. But I think that in a nutshell, that is what I would like to see happen. I would like to be able to bring in people who are at a good place to go into a healthcare facility and potentially be triggered and also be able to provide feedback, because healthcare providers don't get a lot of experience with sex, STIs, talking about it, and they go out into the world and they treat it as sort of clinical or technical in the ways that they were taught to talk about it. Mm-hmm. But that doesn't quite reflect our experiences. There was a statistic I saw at a Planned Parenthood. It said it was like 68% and 72%, and I forget which statistic applied to which, but healthcare providers don't initiate conversations about sex with their patients, and then patients don't initiate conversations with their health provider about sex. So there's like 20-ish per 28 or 32% of people where conversations are even being had about sex, and we don't really know who's initiating that conversation. Mm-hmm. So I think that there needs to be a little bit of comfort there, and I think that something like this in this conversation is a gateway or segue into being able to bridge that gap in communication.
Yeah. Well, and I think to what I agree. And I think like something that I learned from you, or something that you just drilled home to me, ever since we met and ever since I started listening to your podcast, is how important, and this should, this is kind of obvious once you think about it, but it's like, it's so much more than the medical technical side of the healthcare that you receive, right? It's like there's that emotional, and that's something that you are doing, and one of the many things that you do in terms of filling the gaps is providing that emotional support. But wouldn't that be nice if we could get that in the doctor's office, where we're getting some news that might be difficult, but the provider's actually taking some time to really talk to us, maybe even give us a fucking hug or something. I mean, depending on if that's something but you know what I mean? Like it so often just feels rushed. And that's, I mean, cause like I've, aside from us working together, at that, marketing PR place, that was where the Dating Positives came from. I've written a show about healthcare cause it's so shitty. I went to grad school for journalism and focused on healthcare because it's broken in so many ways and it affects us in so many ways. And something that I've noticed and realized is, forget if they're a bad provider, a good provider in terms of their ignorance, whatever. They're also just dealing with the fact that quite often they only have 15 minutes to do the whole visit with you. And that's not their fault. That's literally, like, I was looking at my little portal. I have an appointment coming up for a gynecology visit, and it's 15 minutes long. Like, what are we gonna do? And that's what and realizing, because I went through a phase where I would call out doctors when they'd come in late, and I'd be like, hi, like, I don't want to start off on a bad note, but I'm just stressed out now because I've been waiting for 45 minutes, which is so common, right? We don't usually get even seen on time. And I actually had a few doctors say, well, it's because I only technically have 15 minutes with each patient because of the rules of the practice and insurance billing. And so I'm running late because I can't do. So that's actually, and that made me feel a little better when I am waiting, I'm like, okay, well, it's because they're trying to give more than 15 minutes to the person before. So all to say, it doesn't excuse other shitty things, but I do think that in a way, even doctors and nurses and providers who want to do well, they are working in shitty conditions that aren't actually meant to, be good for the patient. And then there's the shitty people who are just shitty assholes, and that's like often a separate thing. So yeah, it's shitty, but I love your idea of finding a way to do really thoughtful vetting of, I think, practices and then providers individually, because that's the other thing. You can go to a place, like I'm going to a queer, it's called Callan Lord. Anyone in New York has probably heard of it. It's a queer clinic here in New York City. They're very great in certain ways, especially being queer and trans affirming. But that doesn't mean every provider there is good, and there's also other problems. So it's like, yeah, I think I really like your idea.
So I work at a medical university, and we do these simulations. I'll read a script, I'm this person, I have these issues, and then I go in and the medical student has to figure out what's wrong. And all while doing that, like, I'm judging and critiquing their communication with me, like how they're making me feel as a patient, and providing feedback on that. So what I'm learning is that in the setting, like, these are people. And just like how you said, you mentioned, hey, I'm a little bit stressed. I've been waiting for 45 minutes, and then they were able to explain to you. I think that once we introduce them to the idea that it's okay to be human, and you can say, hey, I needed to be with this other patient for a little bit longer than what's required. We're supposed to have 15 minutes. That, to me, really humanized healthcare professionals, in my opinion, because we don't see that. I think we look to them as the end all, be all, know all. And for me to see them in the student stages, kind of like a little bit nervous or fumbling through things, I'm like, wow, y'all, you don't just become a doctor, a nurse, clinician. Like, you don't just get there. There's a pathway to that point. And part of me thinks that, like, what you did in just engaging and addressing, hey, you did this, here's how I felt, not only enable for the healthcare provider to, like, let their guard down and be human, but also give you insight to a much bigger picture. And I feel like that's what I'm able to do in the space that I'm in, is see that component and go, oh, okay, here's an opportunity, because how you just worded it made me think, okay, at an institution in medical school, there's this much time to get this much information across, and then test and make sure that this information is consumed. So while small components of that, like, we go to doctor when something's wrong, mm-hmm. and we want it fixed. That's point A, like, what we're there for. But one thing that I see is that the more you can get a patient to share, the better the care that you're able to receive or give to a patient too.
Yes.
I thought you were about to say
something. Oh, no, I am. Well, yes, and I think, I love that you're doing, like, medical simulations. That's something I've wanted to do too, actually. That's been on my list of things. And that's another thing to remember too, is the vast majority of medical school is not having these experiences. Like this training you're doing with them where they're dealing with a trained human being who's, helping them learn their bedside manner and things like that. That's a very small percentage of what they're learning. Most of it is like textbook, which again explains why some of them are total shit at doing what they do. And, and I just want to say, like, because I definitely advocate, like, I think more patients have to kind of stand up for themselves or share what they're going through in the interaction. But I will say that is not easy. I want to just say that that's not always easy because, again, I'm someone who thinks about this a lot. And I've still had times where, because of that power dynamic, because, yeah, they're human, but they still have a lot of power. And even if we know it logically, like, whatever, I'm going to stand up to them, it's so easy to feel shut down. And it only takes like one no from them or, something condescending for you to be like, okay, never mind. For whatever. Okay, I'll do what you say. And I've had that too. So I don't want to say, oh yeah, it's so easy, stand up to your doctor, but there's things you can do. Like something that I've been doing recently with, because I was dealing with some health issues and it felt very overwhelming. And as I'm sure a lot of people can relate to, when you're in the middle of a, especially kind of an unknown, uncertain health situation, going to the doctors sometimes is the worst part of it. Because you're just like, I just want an answer. I just want to be in the right place where hopefully this person knows what this is. And I was going through that and I felt so exhausted by the prospect of also having to repeat myself over and over to the different people. So I just started typing. Like I would type a list and like give the paper and be like, can you please read this? Like at the very beginning, like, can you please read this? Because I don't feel like I have the energy to explain it out loud. And what that let me do is also just make sure I didn't forget. Because again, in the moment, depending on what they say or don't say, you can get thrown off. And sometimes you just forget that important thing you wanted to bring up, and then it's over, and then you have to wait like sometimes months to see them again. So I really say, if you have trouble speaking your talking about whatever you're going through, I highly recommend typing a list. And it can even include things like, I feel, I get very nervous in medical interactions, like please be extra gentle with me and take extra time to explain. That can be on your list of things to ask for, because they, at the end of the day, like in a way you are the customer, so you have the right to really be clear of what you need from them at that time.
I'm glad you said that about the list, because when I do talk to people who are newly diagnosed with herpes, they don't generally know what questions to ask. So they'll say, my doctor did this, I don't know what to do next. And after a little bit of, I've had plenty of experience with speaking to people specifically about this, I've been able to come up with general things that you may want to know that are, I guess, relevant. People often want to know things that there's just no answer to, but it's okay to ask those questions. And I think we expect from the healthcare provider to be the end all be all of whatever the solution or answer is. And that's not always the case. One thing that I notice happens is that generally people who receive taking it back to herpes diagnosis, and I tried to just stay away from it, but I can't.
You don't have to.
Just this herpes thing, man, just doesn't go away. Pun intended. But no, when people are receiving a diagnosis from a healthcare provider, the way that diagnosis is delivered, it influences not only how a person goes on to disclose their status in the future, but if that person goes on to disclose their status in the future. And a lot of people that doesn't click with people until I word it that way, because a healthcare provider can be very dismissive and just be like, oh, herpes, no big deal, you're fine, just wear condoms. And a person might be looking for a reason not to have this conversation with people. And this is a credible healthcare provider. We look to them as, the almighty resource. So what that person says is word, like that is law, right? So I've heard from people who've been told you don't have to disclose. I've heard you can just wear a condom. As long as you take medication, you won't pass it on. As long as you don't have symptoms or an outbreak, then you're fine. Saying things in this way, what that tells me is that there is an inconsistency across the board, specifically on how to talk about herpes. But this is just like one entry point to a much larger thing where there may be inconsistencies in just dealing with people. And if the people don't know what questions they have or what questions to ask, they're going to walk away from the doctor with whatever they gave them and just apply that to whatever questions may come up later, right?
And that's when I want someone listening. If a doctor says, oh yeah, you don't need to tell anybody, I would love someone to ask the doctor, oh, so you'd be okay if someone didn't tell you about their sexual history?
Ain't nobody who's newly diagnosed gonna be in that place.
I know, but I'm just saying, but asking that to the doctor,
yeah.
It's like, so you wouldn't care if someone, like,
of course I would.
Yeah, exactly. Like, that's when it's like, yeah, that's when I want the human to talk to me and not just. And we've talked about too, and I think this is probably because of those sneaky little CDC guidelines that kind of.
Don't get me started.
Well, I want to bring it up. We don't have to go there so far, but it's again like it's just frustrating. Again, this is at Callan Lord, which is supposed to be, it's like very sex positive, queer, whatever. They're all about, I mean, every time I go, they're like, do you want me to swab your throat for like gonorrhea? I'm like, they're very open and positive in some ways, but I wanted to get tested for Lyme disease because when I was going through my symptoms, it seemed, it could have been Lyme, it could have been autoimmune disease. So I was like, I want to be tested for Lyme disease. And the doctor, who I've since kind of fired as my doctor, I can talk about that later, but I was having such bad experiences with them, including the fact that, I asked for a Lyme disease test, and you know what they said? They said, no, I don't like doing that. If you didn't have a known bite, like if you didn't know you were bitten by a tick, I don't like testing for Lyme disease because it's just an antibody test. And so I don't like doing that because it's like the herpes test. We might give you like a false notion that you are positive when maybe you just have the antibodies.
There's a better way of saying that. Like there's a much better way.
Yeah, but I'm also like, maybe I want to know if I have the antibodies. Like, let's cross that bridge. Like, you're saying I'm going to freak out because I know I have antibodies. Like, how about you help me not freak out? Like, why don't we just find out and then we can decide what to do from there? But the worst is being told no because my thing too is, we could talk about this later too. I think there's a lot of limits to what medicine can even do for us at this point. But one thing they can do, the Western medicine, is give us blood work and like, things like x-rays and MRIs. So that felt really, to me, I'm like, that's the one thing you can do for me where we can do a test. And you're saying no because you don't want me to get scared. I mean, it just, and the fact that they brought up that it was related to herpes, I was like, you gotta be fucking kidding me.
Yeah.
Like, how many people are you saying no to who are asking for a herpes test because for the same reasons? And again, sure, maybe it's a little ambiguous, but at least, like, what's the harm in knowing? And maybe that'll reduce stigma if providers like, sure, let's find out if you just have the antibodies. And what might that mean? Doctors don't like it when there's no clear answer on things, but I think they have to get a little more used to it because there's so much gray area in our health.
Yeah. I was going to touch on something and then I let it go, and then I was going to comment on the last thing that you said, and then I was trying to reference back to what you said before. And
I'm sorry. I've been going all over the place.
No, it's fine. Because the closing statement that you made, what it makes me think of is, I remember now, the Lyme disease, and I wanted to bring that to herpes. There is no clear answer. I really don't like the way that person said, I don't like doing this.
Yeah.
I don't like doing this test because ... I think that that's an example where the humanity comes in, but it's just not, it's not right. It's not appropriate. It's, I personally just don't like doing that test. We shouldn't do that test.
Right.
Versus this being, okay, well, are you having these particular symptoms? And then ask these questions to the patient and say, okay, well, we generally test under these conditions. If you don't have those, it's likely that you are not experiencing any symptoms of Lyme disease, we can do a test. However, the results of that test are likely to not be accurate, and I recommend against it. However, if you do want this test, I want to make sure that you have all of the information before moving forward. That is so much different
I
than
know.
I don't like doing that test.
I know. I was gonna say, Dr. Courtney, please be my
Hey,
Dr.
listen, that'd
Brain.
be all I can do.
Yeah, no, but you know what I
That'd be
did?
it.
You know what I did? I just went to another fucking doctor in the same practice and asked for the test from them, and they were like, okay.
Yeah.
Like, I just had to go around them, and then, but again, that's like, okay, that's wasting my time. Because I'm going to have to find somebody else. And guess what? It was negative. So, we could have done it, and it was,
But
whatever.
it wasn't a false negative becomes the issue now. Like,
I
that
mean,
doesn't mind fuck you.
No, I don't
I
think.
didn't mean to say, dang, I was doing so well.
Yeah.
Now I gotta put the little E
Oh,
on
whoops.
the
I definitely
episode.
said the F word, too.
Oh.
So.
We here now.
Yeah, but anyway, it's one of those things, because again, I wanted the Lyme. I actually didn't, I knew that it was probably not Lyme disease, but again, I think for so many of us, there's emotional things. Like for me, I have a good friend who I have a good friend who has Lyme disease, and it's really it's debilitated him. So for me, it's almost like a health trigger. Like whenever I feel off, I'm like, do I have Lyme disease? And I know that's something I have to get over. But again, I was having real symptoms at this time. So for me, it was like, I just need to cross this off the list for my own mental health. And to be told, no, I don't like that. I'm not going to do that. That really, again, I was so rabidly like, I need to find this out, that I just went to somebody else and they let me do it, because I think they recognize, like, yeah, this person we just need to like do this, and it was fine. So yeah, I think that's the other thing sometimes doctors don't know. It's like we're asking for things because we really do know that we need it, maybe just for emotional, mental reasons.
Mm-hmm. And yeah, the way that we deliver the information is very important too. In these simulations at the university that I work at, what I'm learning is a lot about conditions that are common and how easy they seem to be to like avoid. Diabetes is a perfect example. So my great grandma got diabetes. My grandfather got diabetes. I think my grandmother, who died when I was 12, had diabetes as well. I was like, man, diabetes is very prevalent. And it was actually my herpes diagnosis that made me start looking at sugar, because that was something that triggered an outbreak for me. So I was like, oh, well, I'm going to watch my sugar. And I saw how much stuff has added sugar in it, and I'm the sauce king. I put sauce on
Sauces
everything.
I'm also not doing sugar because of my like long COVID immune thing, and yeah, you can't have any sauce basically.
It's like I got peanut sauce. I bought some peanut sauce at the store. I was like, I'm gonna make my own Chinese food. And when I was making it, I put like my assortments of sauces. I was like, 40 grams of added sugar and all of these other things. And I see why my family has had issues, because there's everything that has added sugars. But here's what's interesting. So I learned this from a medical student. This is the best way that diabetes has been explained to me. When we eat, our body produces insulin, and insulin comes out to capture the carbs that are then turned into energy for us. Now, if we have too many carbs in one sitting, what happens is the amount of insulin that we produces can only take in so many carbs. The excess carbs then they turn into sugar. And that sugar is what we're unable to absorb and burn off as energy. That is where we end up with like being in the diabetic state, because we're unable to produce enough insulin for the carbs that we intake. So rather than it being a matter of take more insulin, it really should be consume less carbs per sitting. And there was a period where I would do like every other day, no meat. And looking back, this is the most ridiculous thing that I've ever done. I would have mashed potatoes, macaroni and cheese, some type of bread, and these are just like all carbs. So I'm consuming a day's worth of carbs in one sitting, and that's just like lunch. What about dinner? Dinner's probably going to be the same thing, right? And that's in one sitting. So if my body's only able to capture and bring in, let's say 40 grams of carbs, if I'm eating now a sandwich, which one slice of bread is like 20 grams of carbs. So boom, two of those, you got 40, and then a bag of chips or French fries, that's like another 30. And nobody's eating just one serving of chips. I don't care what nobody says.
No.
So I'm doing that same thing. And so it took for me to hear from a medical student how diabetes works for me to understand, oh, this isn't a matter of like, oh, I just need to work out more, or I need to exercise more or eat less sugar. It's everyday things that I eat. Like I have to essentially shift my pattern and consume less of that. Everyone just says, oh, eat more leafy greens. But the reality is you have to consume less carbs. And this is just like, again, something I learned from a student.
Mm-hmm. And it's hard too because again, I've been changing my diet because of my immune system issues, and sugar is bad for a lot of those things.
And it's in everything.
Yeah, and alcohol. Alcohol is super sugary. But I'm also, anyway, my point is it's hard though because you find that stuff out, and like you said, then you kind of realize what is, like sugar's a huge one because like you said, it's in bread, it's in alcohol, it's in sauces. And so those changes are really hard to make.
Very. Because
it's not just taking a pill. It's like, okay, I have to rethink my breakfast. I have to rethink my lunch. I have to rethink my dinner. I have to rethink when do I want to do those things? Like when is it worth it? Because I have diabetes, a lot of that on my mom's side of the family too. And so that it's very worrisome.
That shit expensive.
It's expensive, and you can like lose your feet, and it fucks up a lot of. It's like it fucks up your blood. That's the other thing, though. It's like the other thing I don't like. This is making me think of another thing I don't like about Western medicine and our healthcare system. It's everything's so separate, but it's like with diabetes. Yes, it affects your ability to like a lot of times your pancreas doesn't work. You're not able to produce your own insulin. But then that affects your blood. Like people with diabetes, like usually like their cuts take longer to heal. Like they get clots. Like that's why a lot of people have amputations. So it's also like it affects so much more. Like it's also connected. There's also, I don't know about type 2, which that's the kind I think that's in my family.
That's the one that's in my family.
But type 1 is an autoimmune thing. And that's the other thing we don't understand, like what is up with these autoimmune diseases, because they do a lot of damage, and there's quote unquote there's no cure.
Conspiracy theory Courtney thinks that we just produce the shit essentially. Like healthcare is a business.
Oh.
And we've got like the foods that are so easily accessible. Like you have to pay more for them to put less in your food.
Oh yeah. Well, I think conspiracy Courtney is right in that there are actually some programs that are experimenting with like, let's push healthy foods like in the hospital, like let's have that be part of the treatment plan. And it's because it's like, imagine if we just had good foods that didn't have corn syrup in them, because treating things with pills will only get you so far, especially if we put a mindset in people that like, oh yeah, if I just take this pill, it'll undo all the bad. And it's like, no, that's not gonna probably be enough if you're. And
it just stacks.
Yeah, because it accumulates.
If I think that way, oh well, okay, if I get high blood pressure, then I can just take these pills, but I'm gonna continue to eat the kind of foods that have given me high blood pressure, hypertension, and those foods are also going to give you diabetes. Now, diabetes and hypertension are things that I'm taking medication for. These medications have their side effects. I'm going to do something to alleviate those side effects. And we get to a point where we're just like, our body's just like, hey, I exist and I could, combat a lot of this if you just give me the right conditions in order to do so.
Yeah.
And we're just not taught to give our body those right conditions to do so. The few ads that we do see, or the marketing that gears toward combating problems and taking pills, is diet, exercise. And even then, it's like it's something that we're being sold. And I don't think that there's any sort of a goodwill campaign that's just out there like, hey, everybody, all things in moderation. Because that's really
Yeah.
what it's about. I don't need peanut sauce, soy sauce, sweet and sour sauce, teriyaki sauce, and sweet and sour sauce with my Chinese food meal of rice and chicken, right? Or with my chicken nuggets. I don't need barbecue sauce, ranch, buffalo sauce, Polynesian sauce,
You're making me hungry.
I know.
Yeah, like I'm not eating. One of the things that's been messing me up is soy products in miso. And so, yeah, I'm eating sushi with no soy sauce. It's doable.
So dry. Is it dry?
You
What
don't
are
have to make
putting
me
on it?
don't make me depressed.
Wait. Do you do the
I use ginger. I'll still do some
Okay.
ginger and wasabi, and like Lizzie has ginger in a jar that's like it has the juice, so I can make it a little.
Maybe
Yeah, but
that's
it's a
it.
little.
Like, we just need to wet it.
Yeah.
It's
But
not
honestly,
the sauce,
though,
it's the wet sensation.
I've learned though to be like, okay, at least I get sushi.
Yeah.
That's how I'm trying to think of it. At least
So
I can
much of
have
it is
some.
mental.
Yeah, at least I can have some sushi. Like, yes, I would like to have soy sauce, but I also don't want to like itch all night.
Mm-hmm.
So it's a little bit of a give and take situation. And I also just want to say, the thing that you're making me think too is I feel like a lot of the way that health things are presented, especially with like the wellness side of it, is it's very also like to blame yourself, even if there's genetic predispositions, like, oh, what did I do wrong? It's like I ate the wrong thing, I didn't exercise enough. But it's also just like we live in a fucked up world, and a lot of us don't have time to rest. We're worried about money, and those just aren't conducive. Those conditions aren't conducive to, like you said, letting the body naturally recover from whatever it is we need to recover from. And like you said, it's so much more work and money to eat foods that aren't bad for you.
Yeah.
I've been going through it. I'm spending so much. Like, I stopped smoking weed and I thought, oh, I'll save a lot of money. No, I'm not, because I'm buying like fancy chicken and like vegetables. I'm trying to eat like fresh. I'm trying not to eat leftovers. So that means I have to also go shopping more often because I want to like not, so it's so much work. And not everyone even has the time to do that.
Mm-hmm.
And like we don't even have, like, we're struggling even in the White House right now to like pay for sick leave. It's like, so it's like no wonder, it's really it's not a good. And that's why, again, that pills, there's like a very in a world where there's no like national paid sick leave, paid family leave and things like that. It's like, yeah, like if something hurts, let's just treat it with a pill because I have to keep going.
Damn, that's a whole nother conversation.
Yeah, it's a whole other thing. I know I'm getting us to have these little sidetracks.
But what I'm thinking is my role in what we're talking about here appears to be sort of like a health liaison, agent, coach, something there, because in my day-to-day sexual health advocacy, it's this concept that sexual health is mental health, and through that I've learned that sexual health is whole person health. I've learned that mental health is whole person health, and so much of me coming in, hey, my stomach hurts, and then with the correct sequence of questioning, I may be able to share things about my lifestyle that probably need to be changed beyond just smoking cigarettes or drinking alcohol or doing any recreational drugs, but also the environments I'm in. And it's so tricky because I think doctors do have it hard. Doctors, healthcare professionals in general, have a very tightrope that they have to walk on between being professional and being offensive. If we look at what's what?
No, I'm just laughing at that. I don't know.
Well, and I say this because like the way that a person might ask, well, how did I get herpes? The obvious answer is that you had sex, right? So a doctor saying that it's like, oh shit, I have to be very careful with how I word this. Well, and then you've got to like use parts of your brain that are simple and not really what you went to school for and what you learned in school, and you've got to like just you've got to be a certain type of person in order to do that, right? Whereas if I ask, man, how did this happen? For you to be able to just objectively be like, hey, well, here's some of the statistics. The reality is a lot of people have it. And the 87% of the population of people who do have it don't know that they have it. So you might have just gotten it from someone who didn't know they have it. And that is completely different than, well, you had sex. That's like the obvious answer, right? But and that's probably not the best example, but I see it with the students, like how our interactions are. I know that they're like looking for the right thing to say, or they're looking for a way to word it in a professional way. And I think going back to what I was starting to say with the like coach piece, it's being a middleman, so to speak, for people who just don't know how to engage with their healthcare provider, right? And I'm someone that people feel safe saying a lot more to me in relation to herpes because I'm open about having herpes, to where I can give them essentially a script or an outline of what to take to their doctor. Hey, this antibodies test is really confusing to me. Does this mean that I do or don't have herpes? I don't know. I take these medications, and I've read online that the herpes medication causes these symptoms. Are these things going to conflict? And these are just like things that people in the moment of being diagnosed are just not going to think about or not going to ask. And there requires a level of safety in order to do so. But anyways, I use that example because there are so many human components here, and I think that the only way to really identify what the healthcare providers need in order to be able to better support patients is going to be to talk to them and present them with what patients are saying, so that I can get their responses. Well, here's why. Here's some issues that we have with the system, and then we can look at what changes can be made to accommodate for what the system is doing, because that's really all we can do. I don't see myself like coming in and just, it's been 6 years. CDC they ain't talked to me yet. So
and you've tried.
They ain't opening my DMs. They ain't accepting my proposals. I got one of my board members is on the board of the CDC's STD Prevention conference. She's like, oh yeah, how about this one? And they shot that shit down. It just didn't get voted on.
Wow.
Let me say that. I don't know what actually happened objectively. I know she saw it. She was like, hey, I vote for this one. And I didn't get to speak. I did get to teach a yoga class there.
You're an incredible person. I hope this project moves forward, especially because, like you said, I think reaching the doctors is really important. Getting patient feedback, but also like training, like that's the thing, training the doctors, finding out what they need help with, giving them, some training on how to talk to someone who has a diagnosis. And like, also I think even using, like, creating a space where they can help each other. Because some of them, there are probably not as, it's probably more of the minority, but there are a couple who are doing it well. And I think, like, being able to show that and be like I think I've told you this, I asked, okay, sorry, my brain's all over the place. I just wanted to say, before I say what I was going to say, the thing that makes it so important that doctors know, and nurse practitioners, nurses, whoever, and because that's the other thing, nurses shouldn't be left out. They very often are. And that's why you have some really shitty nurses. You have some incredible nurses, but then you have nurses who, it's like, yeah, they didn't get trained in anything, because people are like, nurses, whatever.
And then we can also add like that component of burnout.
Oh, yeah. Especially with COVID, like, these people are overworked, they're dealing with stuff. But the other thing I was going to say, I think this is so important to get medical professionals trained in how to make people comfortable and to deal with the mental health side of it, is also because, let's be honest, like, a lot of times people might be going to these doctors for, and they might be getting a diagnosis, and that might be the first time they've met this doctor, because a lot of people don't have a primary care health provider or a regular place that they go to, for many reasons. Like, for a while I was switching insurances every year. And so that would mean like I couldn't always keep the same doctor. So anyway, my point is it's very important also for that reason too, to be able to create that comfort, even if it's the first time you've met and you have to kind of give somebody some not so easy news. But what I was going to say is I think, I was asking my old gynecologist, again, I can't see her anymore because of insurance, but she was my gynecologist for a while. And I remember asking her because, we were, feel like new in our work relationship, and I was thinking a lot about it. And I was saying to her, I was like, what do you say to someone who gets a herpes diagnosis? And she said, like I say a lot of things, but she was saying like one thing people a lot of times will ask and they'll be very upset is like, will I ever find love again or sex again? Will I ever find, be able to connect with somebody again? And what she said, I almost cried because she was like, you know what I say to them? I say that, sure, like there might be some people who like, that's a deal breaker for them, but, for everybody, there's people for whom like risk is worth it, because that's the thing. She was like, there's always a risk with a sexual encounter, and the question is whether or not that person one of the big things is whether or not that person is worth it. And she was like, and I tell the patient like, you're worth it. And I was like, I'm gonna cry, like, because I can imagine that. And she's really thoughtful. So I also think this program should show examples, like not just focusing on you need to do this better, you need to do this. It's like there's people who are a positive example. It's just a matter of finding them and showcasing them as an example, because I think maybe it would help them if they saw like it could be that simple. It's like you said, it's really just dealing with the human part, the human person in front of you who has emotions of how this is going to affect their life. And it's not just, oh, am I going to have an outbreak? It's like, yeah, how is this going to affect my relationships?
Yeah. So, I mean, I guess with that said, it's important to survey the healthcare providers, interview healthcare providers. I have a network of people that I can tap into to just sort of see where they are and identify what questions need to be asked, what resources need to be available to them. And I think that really is going to come down to time. So how can we make time more efficient? That may look like getting people, getting patients even involved more, general people, the general populations involved more. There's a lot of volunteer organizations. There's a lot of like sexual health related organizations that do a really good job, because the people who are there, you care. Not to say that the healthcare providers who are getting paid don't care, but I recognize that there's been a huge difference in how I engage with my sexual healthcare provider at a sexual health related organization versus a primary care physician. That's completely different. And there's lessons to be taken away there too. And there's the environment that plays a major role in it. So as I begin to dive into this and explore the other side of what I've been doing over the last 6 years, which is working with the health professionals now, I want more stories. Like I want for people to share more details around their experiences with healthcare professionals, so that I can get your side, take it to the other side, and begin to build that bridge that can hopefully bring us a lot closer together, and we can increase that decrease that percentage that I talked about earlier of between healthcare providers not talking to patients about sex initially, and then patients not initiating conversations with their healthcare providers. So yeah, I'm pumped for this. I thank you for being willing to get started with this conversation. That's a wire hanging. I thought something was crawling. I don't know what I thought. But no, I'm very thankful to you for helping me with this accountability episode. I guess I want to call it. And yeah, we'll get to see how things progress. Of course, I want to have you involved as best I can, whatever that looks like. So yeah, thank you.
Thank you. It's nice talking to you in person.
Yeah. Oh yeah, I'm in New York today. at the time of this recording? February
10.
What's that? 10th. Wow. Days are running together. All right, that concludes this episode of Something Positive for Positive People. Please like, rate, review, subscribe to, share this podcast. You can also donate by visiting the new and improved SPFPP.org website. Thanks again, Jenny. And you can follow me on Instagram at CourtneyBrame_. I'm on TikTok. I don't like it one bit, but I'm on there. And that's CourtneyBrame_ as well. Be on the lookout for the HSV survey. If you're listening to this and you're someone who has herpes, the 2023 HSV survey will be released as soon as we can get IRB approval. It's pending. It's been pending since like December. Holidays and all these other things that they got going on have probably slowed that down, but there's going to be that. And then I'm going to start working with healthcare professionals. All right. Till next time. Yeah, next episode.